Thanks, Glenn. That was great. Thanks to this panel, an excellent conversation going from downstream to very upstream. Let me invite Jim Bloyd, Andre Perry, and Cassandra Joubert to join me on the stage here. As we go into our next panel, I promise it's our last panel before we go to lunch, and your lunch speaker, Angela Glover-Blackwell, I know we're all looking forward to that. In this segment, we're going to talk about a series of reports that we at the Joint Center have created. We call them Community Health Equity Reports. You all can sit anywhere you like, but there's one microphone on each side. These reports have been very important for us to document the geographic distribution of health and its relationship to race. We use place as a frame to get to race, to understand a form of structural racism that is residential segregation. David Williams and others argue that residential segregation is the root cause of the health inequalities that we see. And of course, all of you know why this is. When you see high concentrations of people of color, typically you see high poverty rates and a heavy concentration of health risks, be they environmental health risks, poor food, other sources of stress. And at the same time, you often have a lack of health-enhancing resources, access to healthy foods, healthy spaces for exercise, recreation, and play. So it's important in this work that we document those health risks and those health resources and their relationship to communities of color. And this is the exact purpose of these community health equity reports. Outside, we have a summary of the 4 reports that we've released to date, 3 released previously and 1 that we'll release this morning that I'll talk about. So I encourage you to pick up this summary. Let me first thank the funders that have made these reports possible. First, of course, is the W.K. Kellogg Foundation, which has generously supported Place Matters since Gail Christopher conceived the idea of Place Matters in 2006. These reports that we're presenting today were specifically funded by the National Institute on Minority Health and Health Disparities of the National Institutes of Health. So we thank both of these sponsors for making these reports possible. They're prepared by the Joint Center in collaboration with our Place Matters teams, and I want to also acknowledge our research partners who helped to pull together the analyses and the geographic information systems maps that make these reports possible. First is the Center on Human Needs at the Virginia Commonwealth University, directed by Dr. Stephen Wolf. The GIS maps were created by the Virginia Network for Geospatial Health Research, also known as Vanguard. And if Steve Sedlock is in the audience, would you mind just standing up, Steve? I want to acknowledge you and thank you for all of your work on these reports. Vanguard shortly will become known as GeoHealth Innovations, so be on the lookout for the good work that they're going to do. I also want to thank Mike Winger, a senior fellow at the Joint Center, whose tireless work in pulling these reports together, crafting the narrative, was very important as we took highly technical research reports and attempted to make them accessible to broader audiences. So I don't know if Mike is here, but I want to thank you, Mike, for all of your hard work on these reports. The purpose of these reports, as I indicated earlier, there are several important purposes. First is to document the geographic distribution of health and the distribution of health risks and resources. It's important that people understand that not everybody has an equal opportunity to be healthy. Sadly, your zip code, your census tract, your neighborhood powerfully shape the health risks that you're exposed to, as well as your exposure to health-enhancing resources. A second purpose is to assess the relationship between social, economic, environmental risks and health, to look at that correlation. We recognize that it's difficult to tease out the causal factors, but when you see the powerful relationship between many of these important determinants stacked one on top of another and health status, we begin to see how they shape health. We look at the association between place, race, and health, again, to expand that frame to help people understand how a form of structural racism, residential segregation, operates to shape health. It's also important in this work that we identify sources of strength and resiliency in communities, and this is critically important because in doing this kind of research, you can inadvertently further stigmatize and marginalize the very communities that we're trying to uplift. We found that in every community that we studied, there are important sources of strength and resiliency that help these communities to bounce back and to fight off these community-level assaults on their health, and we'll provide some examples of those. Finally, all of these reports offer policy recommendations to improve community conditions for health. And they consider, in each case, the political dynamic, the assets and resources in communities, as well as the potential for policy and legislation to create change, long-lasting systems changes that hopefully will improve the distribution of health resources and risks across communities. There are many different target audiences for these reports. First and foremost, obviously, communities affected by inequities. The very communities that are battling against the high clustering of health risks in their neighborhoods. And grassroots and community-based organizations that are working in these communities are obviously key change agents. They're catalysts for change that need to be informed about these issues so that they can advance their work. Obviously, policymakers and elected officials are also key audiences in this work, and in each instance that we'll talk about here, there are policymakers and elected officials that are part of the conversation and are engaged to help advance solutions. Local news media often becomes an important target audience. Unless we convey the findings of these reports, it's difficult to get people out of that very narrow understanding of what produces health. Health being whether or not you get to the doctor, whether or not you eat healthy food. Those are important, but expanding that frame so that general audiences understand what produces health is a key goal of these reports. Finally, there are other health equity stakeholders that must know about these determinants of health and how we can solve them. So they include audiences well beyond our local health departments. They include our faith leaders, business leaders, education leaders. These are obviously important stakeholders because their work depends upon a healthy population. If you're a business leader trying to sustain a business in your community, if you have a significant chunk of the population that's too sick to work, that doesn't help you. It doesn't help your bottom line. So let me start by releasing a report that we have completed with the help of the Bernalillo County Place Matters team. Health Inequities in Bernalillo County. There are copies of this report outside, both in English and Spanish. We're releasing this morning. It's the fourth in the series of reports that we've released, and we're very proud to release this. At the same time, we're saddened by the findings of this report. We see more than a 22-year difference in life expectancy across different census tracts in the county, and a 12-fold difference in the percentage of low birth weight infants across census tracts. Of course, low birth weight is a sensitive indicator of population health. There are wide differences across census tracts and community-level health risks. We created a community health risk index, which is composed of indicators of employment, crime, home foreclosure rates, vacant housing rates, and other kinds of indicators. What we found is that average life expectancy is almost 6 years less when a neighborhood's community risk index is high compared to when a neighborhood's community risk index is low. In other words, those communities that are more advantaged in terms of employment, fewer homes being foreclosed upon, higher rates of wealth and educational attainment. These communities enjoy collectively the benefits of low community risks. A higher concentration of environmental health hazards such as air pollution and toxic industrial wastes are far more concentrated in non-white and low-income census tracts than in whiter and higher-income census tracts. We found an average life expectancy of 5.2 years less in census tracts with the greatest concentration of environmental health hazards. Unfortunately, these findings are not unexpected. They're what we see in communities around the country, and our challenge is what to do about it. Here's a map, again composed by Vanger, showing life expectancy based on your census tracts. The darker red, oranges to darker red tracts are areas with low life expectancy, and some of the communities in downtown and other parts of Bernalillo County, South Valley, you can expect to live between 66 and 70 years. Whereas if you're in other communities that are far more advantaged, such as Northeast Heights and other communities, you can live to be between 85 and 94 years in life expectancy. These are not naturally occurring differences. We would not expect to see these were the population randomly distributed across these census tracts, but rather they're the byproduct of policies and practices and systems that systematically disadvantage some neighborhoods relative to others. So what do we do about it? First and foremost, obviously, a focus on prevention, particularly with regard to the conditions in which people live, work, play, and study. This is paramount across all of the reports that we've released and is true in every community where we have Place Matters teams. This team calls for health impact assessments to allow policymakers to understand the potential consequences, both negative or positive, of policies, practices, new systems and programs across a wide range of sectors, including housing, transportation, education, many other dimensions that we know powerfully shape health. We call for greater and more sustained and interrelated community investments to address existing conditions in a comprehensive manner. In other words, the scattershot approaches or the narrowly tailored approaches that we've used previously are not enough. We know now that we need to employ comprehensive approaches that very intentionally address the wide array, the multiple barriers to good health found in communities related to housing, safety, the environment, access to medical care, food justice issues, exercise, etc. We call for more effective utilization of land use and zoning policies to regulate the presence of heavy industry and reduce the concentration of health risks. This is particularly true in a community like Bernalillo County, where you see land use policies that don't effectively prevent heavy industry, polluting industries, from being next to or in residential communities. So you have people literally living next to heavy industry, polluting industries, toxic waste sources and sites. We need more grassroots organizing and coalition building to raise public awareness of these health risks and to spur the kind of public advocacy that addresses these risks in creative and constructive ways. And finally, the team calls for data warehouses that allow for data compilation, assessment, and evaluation that allows folk, researchers, policymakers, and others to identify disparities and hotspots and address these inequities in health and social outcomes. Understanding where these hotspots are often can lead us to place-based effective solutions. So this report is now available both online and in hard copy. We're going to be actively disseminating this report and trying to find ways to ensure that everybody in the county, and particularly policymakers, are aware of these issues. I'm very, very pleased to be joined by my colleagues in Place Matters who are leaders in their communities and with their teams. Collectively, these individuals have released community health equity reports. We're going to talk about what these reports have done in these communities, what the impact has been, and what have been some of the initial changes and actions to address the issues that are raised in these reports. So first, on my far left is Dr. Cassandra Joubert, who's director of the Central California Children's Institute. She received her Doctor of Science degree in maternal and child health from the Johns Hopkins University School of Hygiene and Public Health. Prior to joining Fresno State, she served as vice president at the Community Foundation for Southeast Michigan in Detroit, where she oversaw the foundation's $48 million in grant making. Next to her right, is Jim Bloyd, who is with the Cook County Department of Public Health and one of the leaders of the Cook County Place Matters team. Jim has worked in local public health departments in Los Angeles and in Lake and Cook counties in Illinois. At the Cook County Department of Public Health, where he is regional health officer, he is a member of a team responsible for leading the iPlan community health improvement process called We Plan 2015. His work includes tobacco prevention, school health, STI prevention and treatment, and staff development. Finally, to my right is Dr. Andre Perry. He's Associate Director of the Institutional Initiatives for the Loyola Institute for Quality and Equity in Education and leader of the New Orleans Place Matters team. At his institute, he assesses the success of post-Katrina education reforms and also creates enrichment opportunities for students in the New Orleans metropolitan area. Prior to that, he served as CEO of the Capital One University of New Orleans Charter Network, which was composed of 4 charter schools in New Orleans. So please join me in welcoming my Place Matters colleagues. Let me start with a San Joaquin Valley report that you see the cover, and it's available online. This was the first of the reports that we released earlier this year, and so I'll start with Dr. Joubert. This report was fascinating because, like in Bernalillo County, we found a large difference in life expectancy based on your zip code in the Central Valley. Now, the Central Valley obviously is a very large geographic area known as the breadbasket of America. Many of the food products that we eat and enjoy are grown there in the valley. But part of the problem in the valley, as we see in many other communities, is that the more concentrated people of color are in zip codes and the higher the poverty rate, the more we see a concentration of health risks. It's harder to breathe clean air, harder to find healthy foods. In some cases, hard even to find safe drinking water. And so there are many deeply embedded problems in the Central Valley. Some of these communities are unincorporated communities, literally neglected by metropolitan communities because they don't want to incorporate these communities and provide the same services that they provide in their municipalities. And overwhelmingly, these are low-income and Latino communities. So, Dr. Joubert, when you all released this report earlier this year, you were raising some very, very tough issues about place and race, shedding light on the fact that many of these communities have been neglected for generations. Was there any initial reaction? Have elected officials responded? And how have community leaders reacted to this message about structural racism?
Mm-hmm. So first of all, we were really pleased that we got lots of coverage throughout the Valley. The larger city media outlets ran the story. We also had several smaller, like California Healthcare Foundation's newsletter, Kaiser Family Foundation's newsletter. They ran stories as well, and that was very helpful. Racism, per se, has not been a pervasive theme as they have reported on this data. They have talked about place, they've talked about zip code, they've talked about years of potential life loss and life expectancy, and so we've been pleased about that. But in terms of frame, it's been more comfortable for folk to talk about place and zip code, and that's not to be understated or undervalued, because the Central Valley, which we cover 8 counties, that region of California is not what people know about when you think about California. And so that region has been struggling to really have an identity as the San Joaquin Valley, and that's been really helped by this place-based work. So we're not critical of that, but we know that it's been a more comfortable conversation when we focus on zip code and place.
Absolutely. Some of the findings in this report were that life expectancy varies by as much as 21 years depending on zip code. Some folk live to be about 69 years, others 90 or more in some of the most advantaged zip codes. And of course, zip codes with the lowest life expectancy were overwhelmingly Latino and low income. But there are some areas of the valley that are overwhelmingly African American and also suffer from deep health inequities. We also noted that there are areas of higher respiratory risk, again, overwhelmingly people of color and low-income communities. So the frame of place is more comfortable than the frame of race, but of course we're trying to use place to get to race. So what do you anticipate would be the next steps to have a meaningful conversation about race in the Valley?
Well, I'm really glad that, and I see Angela sitting back there, when this whole frame of equity as the superior growth model is going to be really valuable for us in the Valley. Just a week or so ago, there was an article on the front page of the Fresno Bee that talked about how our efforts to attract new industry and employers to the Valley has been really minimized, or is going to be an issue because we don't have folks who are prepared to take those jobs. So the disparity in educational academic achievement and in education is really going to be a problem, and industry folk are seeing that. So when we talk about how do we grow regional prosperity, how do we really change life in the Valley, to talk about it as a superior growth model, I think is going to be our next step. So we're going to have to be bringing Angela back to the Valley to talk more about that.
Indeed, she is in high demand, but we all need to be folk who can carry that message. Yes. Because it's what this point is absolutely critical. Because of the interrelatedness of our communities, even the most advantaged communities are hurt deeply by inequality that persists across our neighborhoods, and that's part of the message that we need to carry forward. Our next report that we released was in New Orleans, and there Dr. Andre Perry did tremendous work to garner media attention to the report. This report was dramatic in that it found as much as a 25-year difference in life expectancy based on your zip code. In the central city in New Orleans, average life expectancy is about 55. But if you live in a more advantaged community like Lake Shore, you can expect to live to be about 80 years old. Mm-hmm. Dr. Perry, how did the community react to this news? And was this something that was startling to some of the community leaders and elected officials?
Oh, absolutely. But first, I want to thank the Orleans Place Matters team members who are here. Yvette Wing, who's the CDC fellow with the City of New Orleans, Mama Jamila Peters, who's with Ashe, Flozell Daniels, who's with the Foundation for Louisiana, Marsha Broussard, who's with Louisiana Public Health Institute. And in that group effort, I think, reflected who we are and how we released the report, and the reaction to it also reflected the diversity of the city. First, we took advantage of a few major events that were in the city around the time of the release, and that was the Black Journalists Association was meeting in New Orleans. So we asked the Joint Center to release the report during that time. That way, we used that conference to echo and to bounce all that information out there. In addition, the Urban League came a month later, and the National Health, where we spoke.
National Medical Association.
National Medical Association. So we looked at critical dates to release the report, first of all. And when you have all those media outlets that can literally serve as a megaphone for you, then all the local papers and radio stations picked it up. We literally had every single media outlet in New Orleans that put out the report. Not only did the mainstream Times-Picayune pick it up, but they did an editorial. The ethnic media picked it up. They did multiple editorials, multiple radio interviews, so on and so forth. But the reaction to it was this amazing. People just could not understand how living literally a mile away from another place predicted 25 years less in life expectancy. So for many of us who are going to put out this data, remember that what gets measured gets done. And if we have that ammunition of a report, people will actually start to work on it. We're now partnering with the Recovery School District. And actually, just a few weeks ago, the Recovery School District announced that they would incorporate one of the recommendations that we asked for in the report. And it's not just because of the report, but it's because we're at the table with this data. The cities here, and they've said numerous times, they use the report for their future reports and for their seeking funds for health initiatives. Mm-hmm. So I think the reaction was, certainly folks were startled, no question. But more importantly, now they're acting on it because people have ammunition in hand to say, if we don't do something, people will literally die at a rate that no one can agree to.
Mm-hmm. Absolutely. And indeed, it was truly a team effort, and the team did a remarkable job of ensuring that many different key stakeholders in the city were aware of these issues. The team is very focused on disrupting the cradle-to-prison pipeline, Absolutely. Right? And it begins with our education policies. So I wonder if you could comment on that, because part of the focus of this report was on something that many of us would not think is connected to health, and that is what happens in schools when there are disciplinary problems and how these issues disproportionately affect children of color. So I wonder if you'd comment on that.
Now, not to say too much about the complicated educational landscape in New Orleans, but we have a very decentralized system. Whenever you have a decentralized system, you don't have much accountability. Schools can create their own discipline policies that the public can't hold them accountable. We know that out-of-school time is a major factor in a lot of other activities that predict for lower health outcomes. So one of the goals is to keep kids and students and youth in school. So we know that one of our policy recommendations revolve around keeping students in school and out of prison. We also know that kids and adults, when they're in prison, absorb a large number of injuries because of lack of accountability on the criminal justice system. So 10% of our overall budget is moved towards, our health budget is moved towards, I think, 10,000 prisoners. Mm-hmm. So we want to change that dynamic. So we put forth a series of policies that are about keeping students in school, changing the culture around what constitutes a an expulsion or a long-term suspension. And that's what the Recovery School District is now agreeing upon. They're working right now, I'm on the team, they're creating a partnership agreement with the judges, the juvenile judges, to eliminate status offenses from the process. Because as you know, students are going literally straight to the judge for minor offenses. And so we just can't have that. And in addition, we are also creating a series of student-centric policies that will have students involved in the policy-making process. I'm an educator, and I fully know it's a lot easier to change behavior when people are actively doing something. And so we're creating a series of policies, and particularly, and if there's any funders out there, we have on Loyola's campus, we have a phone bank, and we put a lot of proposals out there for formerly incarcerated youth to serve as their own advocates by hiring them to work in a phone bank and to legislate for us, for the Orleans Place Matters team during special legislative sessions. And so, again, we want to give folks educational experiences, money, but we also want to change the policy issues that are continuing this pipeline to prison.
Yeah, absolutely. Thank you. The most recent report that we released was in June in Cook County. The cover of this report is seen here, and you can access this on our website. This report was fascinating because in addition to finding the kinds of differences in life expectancy based on place, it also took a sharp look at the issue of food justice. And I know some folks don't necessarily like that term, but the reality is that access to healthy food varies tremendously based on place and race. This is one of the graphics from the report. Characteristics of food deserts and non-food deserts in Cook County. As you can see, overwhelmingly, non-food deserts, which is indicated by the tan line, are not where people of color live. People of color are disproportionately found in food deserts. People with lower incomes, same issue, people with less than a high school degree, also disproportionately overrepresented in food deserts. But notice how stark the disparity is by race. So all of these other kinds of social class indicators, education, employment, et cetera, they're clearly important. But the most dramatic difference is the African-American white difference in terms of who lives in a food desert and who does not. I want to make a quick point before I ask Jim to comment on this. We need to understand where our children live, because their life opportunities are powerfully shaped by where they live. One of the most glaring inequities in a place like Chicago is where our children live and the poverty composition of the neighborhoods that they live in. This is a slide from the website diversitydata.org. I highly recommend it. This was created by Dolores Acevedo Garcia and her colleagues. And you can access data for almost every metropolitan area in the United States. What these data show, if you look at the set of bars on the far left, is that overwhelmingly white children live in neighborhoods with a very low poverty concentration. About 97, 96% of white children in Metro Chicago live in neighborhoods with between 0 and 20% poverty concentration. A little over 70% of Latino children in Metro Chicago live in these neighborhoods, and less than half of African-American kids live in these neighborhoods. But if you go to the set of bars in the middle, where we are looking at neighborhoods with between 20 and 40% poverty concentration, we begin to see that kids of color are disproportionately clustered in these neighborhoods. So about 40% of our African-American kids are in these neighborhoods, and about 25% of Latino kids are in these neighborhoods. In the most extreme conditions, 40% or higher poverty concentration, again, disproportionately African-American and Latino kids are found in these neighborhoods, and it's virtually impossible to find a white child in these neighborhoods. Some might say, well, that's just a class difference, right? Well, whites have greater levels of income, education, wealth. Wouldn't we expect to see those patterns? Well, let's control for social class by just looking at poor children, and this to me is really dramatic. This is where the differences in life opportunities come in. These are children, African American, Latino, and white, who are below the poverty level. Notice how disproportionately poor white children are in neighborhoods with low levels of poverty concentration. Over 90% of poor white kids in Metro Chicago are in neighborhoods with low low poverty, compared with their similarly poor African American and Latino counterparts. On the other hand, those poor Black and Latino kids are disproportionately in neighborhoods with a high level of poverty concentration. So let's be clear. Both race and class are operative here, but this is one example of why we should never conflate race and class. Because if you're going to be poor, you want to be white.
Absolutely. Right.
Jim, let me turn to you. And I apologize for being a little bombastic here. So this report was released just in June.
Right.
But it was remarkable to see the level of engagement from elected officials in Cook County. And here I have to credit Jim Bloyd and the Cook County team. When we released this report, the Board of County Commissioners President, Tony Preckwinkle, was there, endorsed the report, and spoke very highly of it. Jim, would you say a bit about how you all engage with elected officials and what the response has been?
Sure. Well, one thing I really appreciate about all of my colleagues and teammates here at Place Matters is that, as you could hear from Brian's voice, we share the anger and complete rejection of this preventable and structurally, the roots in structure of the kinds of systemic racism that really cuts people's lives short. And it reminds me of a quote, and I think I'm getting it right, from John Powell, who said that the slick thing about structural racism is that whites benefit without being personally racist themselves. And so I think this is one slide, one piece of data that I think bears witness and is proof, and that is a powerful tool that we've been using in suburban Cook County, throughout the metropolitan area, because we include the city of Chicago and the suburbs. But Brian, I just want to mention that I wouldn't even be here without the shared leadership. We have a collective leadership, and I'd like to name my fellow steering committee members right now. John Owens from Center for New Horizons. Sheila Castillo couldn't be with us today from University of Illinois. Danny Block from Chicago State University, and Sheila Muhammad from Fresh Moves. So I'd like them to stand up if you could. To respond to your question, Brian, I just want to say that for us, we're at a real milestone moment. And it would not be, we wouldn't be here without this report and all of the folks who worked on many drafts and crunched some difficult data sets, combined data from the Chicago Department of Public Health, my agency, the Cook County Department of Public Health, put together some beautiful maps, and then our team put together the recommendations that are at the back, the policy recommendations. Clearly, one of the statements that was made by our Cook County Board President, Tony Preckwinkle, I think indicates a level of sophistication that I can't really say exists in many epidemiologists working in public health throughout the United States. In her remarks, which we have on videotape, and I hope we'll be putting that together, she said, it's deceptive to ask people to address their health and to address health inequities by focusing on lifestyle behaviors. Now, I've spoken with folks about lifestyle. I've asked epidemiologists about the social gradient, and they didn't know what the social gradient was. They didn't have a problem with lifestyle, but clearly children growing up in highly segregated metropolitan Chicago and their family and their adults really are experiencing a maldistribution, an unfair distribution of the resources that are required to live a healthy life, to fulfill your full potential. So I think some of the other executive summary items that we have are really good reading, but we have we see echoes and parallels of what we saw from the beautiful tour in the 7th and 8th Ward, I believe, in Anacostia yesterday, where there is 70 or 80%, I believe, of children living in D.C. in areas there where there's food deserts, high unemployment, challenges with transportation, challenges with environmental justice, and other issues. So we still see the stratification I want to say also that our team, in addition to explicitly taking a focus about structural racism, how to talk about that and how to raise awareness and take action, we've also, I'm losing my train of thought. It'll come back to me, I'm sure.
Well, one of the things that we were very interested to learn while we were there in Cook County is that there are some of the commissioners that are interested in taking some steps to address these issues.
One of our most progressive county board commissioners, Jesus Chuy Garcia from the 7th District, really remarked to our group and to the rollout press conference that he's very concerned about the loophole or a shortcoming in our human rights ordinance for the county, which really allows landlords to discriminate against folks who want to rent an apartment using a Section 8 voucher. So another instance of a specific policy issue which we are following up with the commissioner on and to work on that. But in addition, we're also looking at fresh food financing policy. We're concerned about some unique characteristics in our state that may preclude some of this wonderful program money that is a model throughout the country not going to corner stores in our state. And so we're going to be following up on that and making sure that we can do as much as we can about that as well.
Yeah, excellent. Thanks, Jim. I think the issue about Section 8 housing vouchers is critically important because it relates to housing mobility, as Dr. Frumpkin talked about earlier today. Housing mobility includes the opportunity to move out of neighborhoods with high concentrations of poverty and low opportunity and into neighborhoods with better opportunity structures, but it also allows folks to stay where they are if they want to. And this is particularly important as we're talking about issues of gentrification. If we make investments in communities, make them livable, make them attractive to live in, it's important that folk who've been there, sometimes for generations, to have the opportunity to be able to stay, and housing mobility encompasses that aspect as well. All right, our time is limited, so I'm going to ask our panelists to comment on steps going forward. Let me start with you, Dr. Joubert. With this very startling report, what are the next steps for the team in advancing health equity in the Valley?
Well, I think a couple of things. One is recognizing a key audience for us, which is our young people. We have several people, new people who have joined our team as well as attending the conference today. It seems that our young people have really grabbed onto this whole equity lens, and we want to take advantage of that. So we're going to move with that. The other thing, though, is that there is a lot of conversation about equity going on that's not specifically health. For example, the whole education piece that I mentioned. But also we've been talking about how, which is in the health arena, how the Affordable Care Act really gives us a lot of opportunity to push the equity agenda. And also our statewide Boys and Men of Color work, which the endowment funded and Policy Link has been involved with. That is an opportunity for us to advance the equity conversation. So I think for us in the Central Valley, which is somewhat isolated, we have to latch on to where equity conversations are happening in other sectors and use that, leverage that conversation for our ends, and that's what we'll be doing going forward.
Yeah, excellent. Andre Perry, how about the Orleans Parish team? What's next?
Yeah, we're currently solidifying our membership. That's always important to make sure you have a commitment from people over a certain period of time. I can't say that enough. It's about having a group of committed citizens, and it's also about making it inclusive. We have to have the business sector and the commercial sector involved in this. We can't nonprofit our way out of this problem. and so we have to include those folks. The other thing, and I forgot to mention, we held 2 public forums in the release of our report, one on education and one on criminal justice. We had all the muckety-mucks from around the city to join us, for everyone from the sheriff, the U.S. attorney, the head of Teach for America. I mean, we had all these muckety-mucks. And we got them to commit to, one, to at least coming and showing up. But then we also got them to commit to some small steps. And so we're going to move forward with that process because after 2 days of public forums, we get a database of over 1,500 names. And we're going to use those names and build upon the names because it's my personal goal as team lead to have 5,000 names in a database that we will go click, and they will show up to the city council meeting, they will go to the state capitol, they will go, because as you know, this is also just about mobilizing our human and fiscal and economic and power resources. And so we're actually making great strides, I think, in solidifying our membership, getting our database together, having a format to disseminate information. We have our website up. We're very sophisticated with our social media. If you go to Twitter on the PMNC 2012 hashtag, you will see our report. You will see a number of op-eds that we've released over time. We're moving forward. Now it's again, we're going to take advantage of the election. We're going to host a couple of forums around the election, around education, criminal justice, all these other things. We're moving forward, so I think if we continue to do that, we'll continue to chip away at those larger policy issues that are preventing folks from living healthy lives.
Yeah, absolutely. And Jim, the Cook County Place Matters team, what's next for you as you advance food justice?
I think the biggest thing for us is we need to continue to build alliances of organizations and individuals in affected communities to build power. Dr. Tony Aitan mentioned at one of our design action labs a model that, you know, this is a political fight. And that we must be cognizant of building power. How do we do that? And I completely agree with Dr. Perry in terms of mobilizing folks. We've found that when we talk to people about this information, people don't know about it, first of all, and second of all, then they say, this is outrageous, I can't believe it, I didn't know about it, what can I do? So some people will show up at a meeting, others want to become trained to speak about it. So we'll plan to systematically promote our report amongst legislators, but anything that will work to build power amongst affected community members, we will do. So we're going to continue to spread the word in speaking groups, and also find out how we can kind of engage in an advocacy process among the policy agenda that we're developing.
Yeah, excellent, excellent. So let me just leave you with a quote that I like. And many of you have read this, you know about this quote, but I think it really highlights what we've tried to address in this panel. And this is from the World Health Organization Commission on the Social Determinants of Health, released in 2008. I think they got it right when they said that inequities in health and avoidable health inequalities arise because of the circumstances in which people grow, live, work, and age, and the systems put in place to deal with illness. The conditions in which people live and die are in turn shaped by political, social, and economic forces. In other words, we didn't get here by accident. We're not arguing that there were malicious forces trying to deliberately harm people of color, but certainly when we structure opportunity, I'm trying to be correct. You know, we don't advocate, we're nonprofit. The point is that we can undo these systems and structures and ensure that every child has an opportunity to enjoy good health. All right, now I invite you to quickly move across the hallway to Grand